ready for our next briefing on mental health. As I mentioned earlier, it's being called the pandemic following the pandemic. And a lot has been happening. I can't even imagine that anyone on this screen today hasn't been impacted in terms of our mental health in some way, whether it's personal or in our families, or it's just unimaginable at this time during still the pandemic. So an important conversation, and we've got some folks that know what they're doing with us, and I'm excited to introduce them. First, my long-term friend and colleague, Doug Beach. Sometimes I think we were split apart or something at birth, but he, person of faith, can't help himself but do this work. He can't stop. And so he works with NAMI and also the project Bridges to Care San Antonio. So you're going to be hearing more about that. And our civic leader that is with us today, Claude Jacob, he is new to San Antonio, and he is the executive director for Metropolitan Health. And he mentioned it before, but I'm going to test him here. ILL.
INI.
There you go. We both have the same alma mater. We both went to the University of Illinois. Yay! And so it's so exciting to hear that there was some other person from Illinois that was serving with me in the city structure. So he's only been here for a couple months, but he's a fast learner and has done some great things in his past. So I want you guys to have as many minutes as possible. I'm going to lob this to you. It's all yours.
Thank you, Ann. It's a pleasure to be here. As Ann said, I volunteer with NAMI. I'm the board president and currently the interim executive director. But I always introduce myself when I'm doing things like this as really a parent of an adult son with a mental illness. It's very important, I think, when we work in this sphere to be transparent about why we do this and where our heart is in this. And I'm going to run through some slides real quick. I'm going to bring up the slide. We wanted to start with, what's the impact of mental illness in our community? And, 1 in 4 people are going to experience a mental health disorder this year. And 1 in 4 people, so that means in Bexar County, that's over 500,000 people. And on average, people wait 8 to 10 years before they first seek help for a mental health issue. And even more alarming is 50% of mental illness begins by age 14, 75% by age 24. So that means our youth are most at risk for mental health issues. And I think we're obviously seeing a lot of that in the pandemic, but that's the way things are normally. 20% of our prisoners in the local jail have a mental illness. And I think that's low. 20 to 25% of homeless population have a mental illness. And again, I think that's probably pretty low. And during the pandemic, there's been a 51% increase in suicide attempts by young people, which is incredibly alarming. So these are alarming statistics overall. So that begs the question, what's our role as a community to address the stigma surrounding mental illness and the reluctance of people to seek help earlier and the lack of access to care? So not addressing these issues means that we're going to continue to see an increase in suicides, substance use, homelessness, and incarceration. So we have a mandate, I think, to address this. 8 years ago, NAMI San Antonio, which stands for the National Alliance on Mental Illness, began trying to encourage faith communities in San Antonio to become involved in providing mental health support, because we know that more people go to see a pastor, priest, or rabbi first before they go to see any other professional when they're dealing with a mental health issue. So what we wanted to do was we wanted to help begin to foster wise faith communities that are welcoming, inclusive, supportive, and engaged for people and families that are impacted by mental health issues. And 7 years ago, we created the Pathways to Hope Conference, which brings people from across our community to learn about mental illness, where to find help, and how to support one another. And this includes everybody: mental health professionals, educators, faith community leaders, families, and individuals dealing with mental illness. Because too often we don't come together. And this intersection is a wonderful example of how we are coming together and talking about these issues as a community. And in 2020, NAMI San Antonio and Pathways to Hope, we launched the Bridges to Care San Antonio through the conference. We held our first networking session to find out if there was an interest in doing this. There was an overwhelming interest. And today, and we begin by helping bring these faith communities together in cohorts, that is, clusters of congregations that are geographically close together, typically 7 or 8 congregations. And we began training people in those congregations to become mentally health literate. We train community members to become wellness champions, to offer their faith communities the opportunity to become behavioral health friendly or wise, welcoming, inclusive, supportive, and engaged. And as we've talked, as we said at the beginning of this, if we didn't know the need before the pandemic, we certainly know it now. So this initiative, Bridges to Care, has really succeeded beyond our expectations. We already have 375 wellness champions across 54 different congregations. That's in barely 1 year. We're beginning our 2nd year, and we already have another 30 congregations waiting to become wise. And we're revising our core modules. We've learned from the 1st year. We're adding enrichment modules along with NAMI classes and support groups. So the name of the game was not standing up Bridges to Care and training a first cadre of wellness champions. It was really doing that and sustaining it. We see this as a long-term program and effort. Sacred.org, which is a mental health, it's a community portal for assistance. We added a mental health portal this year to assist wellness champions in identifying resources, and the public to identifying resources, not just in mental health, but in all the kinds of social supports that people need. And this interest has already grown. It's expanded from congregations into schools and universities, and will soon reach out to organizations and businesses. So whereas it started with the faith community, it's now doing what I think it really ought to do, which is embrace everybody across the community. That's when we get the best outcomes. So where do we go from here? We need more access to care in our community, places like the Now Clinic in the medical center. We need for neighborhoods across all of San Antonio to become more literate about mental health and more supportive of their neighbors. We need to help break the stigma of mental illness so that people do seek help earlier. We know, just like any other illness, when you get help earlier, the outcomes are much better. We need to become more culturally competent so that we know how to engage diverse communities. Communities are different. People talk about mental health differently depending upon your background and where you were raised and what your experience is. And we need to do a better job in that. So NAMI San Antonio and Bridges to Care addresses stigma, mental health literacy, and support. And so if you or your faith community or your school or business or organization want to help address these issues, you can contact NAMI San Antonio at nami-sat.org. Everything we've talked about is free. And that's due to the generosity of faith communities, of the city of San Antonio, the county, West Care Foundation, and NAMI. So throughout this journey, the city of San Antonio and Bexar County have been great partners. And that's where we are today, talking about the intersection. This is an example of how the nonprofit sector, faith communities, and our city and county are working together. We talked about earlier and brought up with the mayor the need to work across these jurisdictions. And we think that building healthy communities that are wise, welcome, inclusive, supportive, and engaged is our best opportunity to improve lives and outcomes. This is about changing the way we talk about mental health and breaking the stigma of mental illness. And the last slide has contact information, both for myself, for Jerry Gregory, who's our program administrator for Bridges to Care, and for Donna Costa, who's our brand new cohort leader development director. And with that, let me turn it over to Claude.
Thanks, Doug. Really appreciate that overview. Good afternoon to one and all, and bidding you greetings from the nationally accredited Metro Health District. So thank you. Let me at least acknowledge Doug's presentation, the context of what we're doing here at Metro Health. We can send this information back out to everyone, but I do want to say, Doug, that the stats you shared are alarming indeed. Public health agencies across the country and here in San Antonio are leaning in to help address the mental health crisis in our community. So for this afternoon, I wanted to take a moment to reintroduce myself, but also to say thanks to my fantastic team on the ground, in particular, Jennifer Harriet, who's our Assistant Director for the Community Health and Safety Division, and Jenny Hickson, who many of you may know, who is our Public Health Administrator overseeing our violence prevention section, and that anchors our work tied to our trauma-informed care efforts. So just know through this COVID experience that folks have been having over the course of nearly 2 years, mental health has always been important to public health writ large, but really has been exacerbated as an area of need over the course of the last couple of years. So our vision here at this agency, and I've been here going on 6 months, is making sure that healthy people living in a healthy community, and we can't address that without incorporating our mental health efforts on the ground. So I did want to say, because I know this is a two-part segment, so picking up on Doug's comments, I did want to introduce at least what we see to be priorities, why these are priorities here for our agency, but more importantly, how this dovetails with the work that you're doing on the ground. So public health and mental health, we do see the nexus and this intersection that align to overall health and well-being. These are both influenced by the intersection of genetics, culture, and social determinants. We hear a lot of talk, especially the last couple of years, around the different determinants or drivers of health. And poor mental health correlates with health risk behaviors such as substance abuse, tobacco use, physical inactivity, all these things that aim to prevent health through our public health work. And so what we invested in over time, thanks to my predecessor, Dr. Colleen Bridger, many of you may know, she's been in this space, and several years ago, in partnership with many of you, organizations that share similar values and priorities anchored to the work of Metro Health, we began to talk about the fact that early adverse childhood experiences, the ACEs, or the adverse community events or environments, the pair of ACEs in some places, they use that framework, and talking about the trauma or the history of abuse, how they often contribute to mental illness. So we do recognize the need to do something, to do more. And so in the fact that the ACEs not only contribute to mental illness, but that the stress on the body and often results in other chronic conditions that include diabetes, obesity, and other health conditions. And so I do want to acknowledge that our journey didn't just start over the last year or two, but these issues have been magnified because of this ongoing storm that we're experiencing as we speak. I've been in the trenches now for over 25 years. This is now my fourth state. I hail from Illinois, as you've heard from Ann. I ran a health administrative program out of the Sinai Health System. You fast forward to the state. I was a deputy director and helped to put together our statewide suicide plan. And more recently in Cambridge, we established a community-wide network to anchor our work to the behavioral health providers, the psych departments of area hospitals. And so I'm appreciating the village here. And I do want to acknowledge that what we do have in response on the ground is anchored to the work of the South Texas Trauma Informed Care Consortium, STIC. There are a number of initiatives down here, but STIC was created with the central vision of mitigating the effects of ACEs, the adverse childhood experiences, by creating a certified trauma-informed Bexar County. So in addition to that, to providing training to community organizations, just know that we have worked closely with the Children's Shelter, Voices for Children, and representatives from a dozen different sectors to establish the Institute for Trauma-Informed Care, which is run by University Health, and the Trauma-Informed Certifying Entity, which is run by the Ecumenical Center with funding from Methodist Healthcare Ministries. And so this is an exercise this afternoon to connect the dots a little bit to each and every one of you. And these organizations are actively working to assist us across San Antonio to become certified as trauma-informed. So with that, to help address the growing mental health crises, which have been exacerbated, especially over the last couple of years, our fantastic team at Metro Health continues to fund communities and schools to provide cognitive behavioral therapy to children referred by teachers through the Handle Care program, and to ensure that victims of domestic violence and victims of gun violence served by our violence prevention section have access to mental health counseling. So just know that this is ongoing work anchored to our programs in partnership with each and every one of you, and that is by design and has been evolving over the last few years.